Let us know what state and agency you're from, and if you'd like, please also add what you're hoping to get out of today's Learning Collaborative. We especially want to welcome those of you who are new to the collaborative. Welcome. And for those of you who are also returning, have been to the first several Learning Collaboratives, I do have some resources I wanted to share with all of you today before we get started, and then we'll get right to the presentations from two of our collaborative participants. And then hopefully at the end, we will have a lot of time for your questions and any updates you might want to share. Again, just as a reminder to those of you who've been with us before, and for those of you who are new, I wanted to make sure that you were aware of the ARCH resources that we have on our website on volunteer and faith-based respite. Hopefully they'll be helpful to you. Last year, we updated the ARCH Volunteer Respite Manual. And if you're running a volunteer program or planning one, or if you're providing technical assistance to sub-grantees, I think that you might find this manual very helpful. It covers everything from the value of volunteerism, liability concerns, to best practices in recruiting, matching volunteers to families, training, supervising, everything you would need to know to run a successful volunteer program. If you were looking for model volunteer or faith-based programs that you might want to replicate, or maybe just for some inspiration, I would urge you to take a look at ARCH's innovative and exemplary respite services. There are quite a few of those services that are volunteer or faith-based. And just a quick update, we're reviewing applications now for 2022 recognition of innovative and exemplary services, and we should be announcing these sometime in mid to late June. We also have several archived webinars on the topic of volunteer and faith-based respite, including a very recent one that we held jointly with the Break Exchange in late March on time banking. The recording is on the ARCH website, and for those of you who don't know what time banking is, it's really a unique volunteer model that involves the volunteer banking their hours in exchange for receipt of some services later. And it's a very strong community building model, and I think it holds a lot of promise for providing respite and family caregiver support. And so if you're interested in learning more about that, there are two webinars that we have archived on the website about time banks. And then finally, our state tools. We're so fortunate that we have a very generous network of grantees and coalitions and ARCH members who are so willing to share their tools and resources. So we have a catalog of volunteer and faith-based resources on our website that again include how-to manuals, toolkits, descriptions of community and faith-based mini grant programs, marketing and outreach materials. So I hope when you have some time, you can take a look at those resource tools as well. And all of this you can access through that link on the slide. And then I just wanted to share a few national resources that have crossed my desk over the last few weeks. The first one comes from US Aging. They are one of the coordinators of a program you may have heard of called Community Care Corps. For those of you who are not familiar with Community Care Corps, it's a relatively new national initiative, a couple of years old now, funded by the Administration for Community Living, that funds community-based organizations across the country to develop or expand volunteer models that support community living for older adults and people with disabilities. And last fall, the Community Care Corps partners who oversee the initiative, led by US Aging. US Aging used to be the National Association for Area Agencies on Aging. They held a virtual symposium for the Community Care Corps grantees, and they produced a written summary of lessons learned from that event. And I wanted to just make sure that you had the link to that document. The second one is collaborating with faith communities on social engagement. Last March, Engaged, which is the National Resource Center on Engaging Older Adults, held a webinar on how the Aging Network and faith-based communities work together to create opportunities for social engagement for older adults. And this blog post that I've linked to includes some tips from the webinar on how to collaborate with the faith community that I thought might be useful to you in your own efforts. And then finally, I really wanted to make sure you're aware of these resources from the Administration for Community Living. They were developed to help support Older Americans Act programs, but also all the programs like Lifespan Respite that are funded by ACL to help them to engage and work with volunteers in their own efforts. And the first one is a volunteerism study that was actually prepared by the Office of Performance and Evaluation at ACL. So it has some wonderful findings in it. A document on effective volunteer practices. And then finally, the last one on the economic value of volunteers that makes a very compelling fiscal case for using volunteers. Again, I will put these slides, the link to the slides in the chat, so you don't have to worry about how am I going to get to all these links. You should have access to them, and I'll send them around after the Learning Collaborative today with the recording of the call as well. Does anybody have any questions about any of those resources? You could unmute yourselves and ask a question if you'd like, or type it into the chat. Okay, I don't see any or hear anything right now. So I am really pleased today to welcome our two presenters, both of whom have been participating in this Learning Collaborative. They're two very experienced proponents of volunteer and faith-based efforts. And most importantly, they were willing to share what they know, their knowledge and their experience. And I know we're all going to benefit very greatly from what we'll learn from them today. The first presenter is Elaine Whitford. She's the Executive Director of the Center for Volunteer Caregiving in Cary, North Carolina. At the grantee meeting, some of you may remember, those of you who are Lifespan Respite grantees or partners, that Alicia Blader, who was the Lifespan Respite project manager in North Carolina at the time, introduced us to the idea of a volunteer respite consortium as an activity of their Lifespan Respite grant. And Elaine is here today to provide a bit more background on the purpose and structure of the consortium and report on what they've accomplished so far and what they have planned for the future. Our second presenter, many of you know very well. She's going to provide us with some very well-established thinking and history on working with the faith community, and that's Kathy Mayfield Smith. She's the board president and co-founder of the South Carolina Respite Coalition. And she's going to give us an overview, again, of the coalition's long history in engaging the faith community for respite. Again, hopefully with some tips on how to approach and involve faith community leaders and members. And she'll also be sharing an update on their work to establish break rooms. And you'll learn more about those in faith communities through their Lifespan Respite Grant. So without further ado, I will stop sharing my screen and welcome you, Elaine, to the Learning Collaborative. We're very excited to have you.
Great. Pull up my slides here real fast. Well, I'm happy to be here to tell you what we're up to here in North Carolina. I will tell you that we are at the very, very beginning stages of building our Volunteer Caregiver Respite Consortium. So I'm going to tell you what we've done so far and where we think we're headed. First of all, a little bit about the Center for Volunteer Caregiving. We're not a part of our state agency. We're a private nonprofit serving older adults primarily in Wake County, which is the county seated by our state capital, Raleigh, and it's a pretty big county. Our mission is to recruit and train volunteers to provide support for older adults and adults with disabilities who live independently in Wake County. So we're not providing volunteer support for individuals in nursing homes or assisted living. Everybody we serve is still living independently in their home or apartment. We currently have around 245 active volunteers. It changes on a daily basis, as those of you working with volunteers know. But our entire service model is based on volunteers. We have a small staff of 5, 3 program coordinators, a volunteer coordinator, and myself. And we are really managing the programs. We're not providing any direct services. So our volunteers are doing everything that we're doing. The Center for Volunteer Caregiving was created. We're getting ready to celebrate 30 years. We were one of the original Faith in Action programs created, or well, really funded and created by the Robert Wood Johnson Foundation many, many years ago. As the model that we were created for was to support volunteer programs in communities of faith. And if you think about 30 years ago, I'm not sure the internet had been born yet, or it was real brand new. And we didn't have Google Docs and spreadsheets that were easy to share. And so our organization was created really as a sort of an economy of scale to help communities of faith run the programs. But as technology evolved and we evolved and our county evolved, we really became a community-based program. Now, while we still have relationships with many of the faith communities in our county, most of our clients are being referred by the big healthcare insurers, United Healthcare, Blue Cross Blue Shield, Humana, certainly our local partners in our county, Resources for Seniors, which runs all of the county services, Transitions Life Care, and the other hospice programs, a lot of social workers. And then really, while the name of our organization, I say it's a little clunky, it does not roll off the tongue, but it is our best Google asset. Lots of people find us just because we have volunteer in our program. Caregiver support, I'll tell you a little bit more about that program in a second. That's our smallest program. We have 2 other programs, transportation, where volunteers are providing escorted rides for seniors to access health care, as well as food, groceries, medications. And then our largest program is our in-home connections. And that's the program where volunteers are doing friendly visits for seniors who are isolated, telecare, help around the house, actually doing the grocery shopping for an older adult who can't get out on their own. And so those are our kind of our big programs. So our Caregiver Respite or Caregiver Support Program, we've been around for 30 years, but we've operated that program for 22. And I'm sure it looks similar for many of you, but we're sending volunteers into the home to give the family caregiver a break. And that break looks different for every single one of our caregivers. Our caregiver support manager, Lisa Hoskins, couldn't join us today. She's got some COVID family issues going on, but she runs the program and goes out and does an in-home assessment for every family caregiver referred to us. and has a number of forms, does the True-Alta checklist, has a checklist of self-care activities, and really breaks down what that family caregiver needs. So we're providing them with exactly what they need. So this is a very client-centered, focused service that our volunteers are providing. Last fiscal year, in our Caregiver Respite program, we served 60 people with just over 2,100 volunteer hours. In addition, Lisa, who is a MSW and also has her LCSW, she's providing a number of support programs. Probably the one you've heard about is Powerful Tools for Caregivers. That's an evidence-based program that was based in Oregon. I think it's now in the University of Iowa, or being managed by them. We've been providing Powerful Tools for Caregivers for at least 10 years, and it might be longer now. 3 of us on staff are actually certified, trained to provide it, and we get lots of great feedback. During the pandemic, when we had to pivot a little bit, we came up with some voucher programs, some online programming, weekly meditation calls, caregivers night out of the kitchen. We just got super creative about how we could help our family caregivers when they weren't comfortable with someone coming into the home, or we weren't able to find a volunteer for them. So that's a little bit about the program that we're running. As a part of our state's last 3-year Lifespan Respite Grant, Lisa, who is, I just mentioned, is our caregiver support manager, she was actually working with our Division of Aging and Adult Services on this grant. And we are, I think, running the largest volunteer caregiver support program in the state, and there's not many. So that there's not a whole lot that we're competing with for that title. But she reached out to me and said, we're thinking about, and I think this was the brainchild of Alicia Blader, who Jill mentioned earlier, we're thinking about writing into this grant the development of a consortium to just increase creative options for caregiver respite. Because as we all know, our family caregivers are really challenged, and anything we can do to help them, we want to help. So I love consortiums and creating new things. And I said, sign us up. We're in. If we get funded, I'd love to work on doing this. There's power in numbers. And so we ended up, our state was awarded the grant. And then in the meantime, Lisa ended up coming over here. And Tanya Cedars, who I think I saw is on this call, is now the Lifespan Respite Specialist with the Division of Aging and Adult Services. So just a few moving around here. So what's the purpose of the consortium? It's really threefold. We want to find existing programs and facilitate information sharing. We want to support the expansion of our existing programs. And finally, we want to support the creation of new programs across the state. We're very vested in this model. We think it works. We have surveys and get lots of great feedback. And we want to not only build our program, make sure that we're running best practices, learn from other programs, but we want to help build new programs across our state. The consortium membership that we're looking for is very broad. It's not just programs operated by nonprofits like us. We are open to bringing in programs operated by government entities, unincorporated groups, communities of faith. We also, while we are serving older adults and a few adults with disabilities, but we're really 90% of our clients are older adults. We want to open this to anybody who's a family caregiver. So if you're a family caregiver of a child or an adult with disabilities, we want this consortium to be open to everybody. So our first step And when I say first steps, and I said this is pretty new, we really just got going with this in February of 2022. So we are brand new in this. But the first step was to create a steering committee. Our goal was to have statewide representation, and we've met that goal. We have a program from the eastern part of our state, the western part of the state, the middle part of the state, and then of course we're here in Raleigh, which is sort of mid-east, I would say. We're not really middle or east. We're kind of in between those two. Our goal was also to, on the steering committee, have representation of different types of respite programs. But the programs serving older adults are the only ones we've been able to find. So right now, our steering committee has representation of all of the programs are serving older adults. And one of the programs is a hospice program. So our steering committee, the task that we've been working on for the past couple of months is trying to find programs. And we are finding it to be a humongous challenge to find the programs that are either run by communities of faith or by an unincorporated group. There is a movement in North Carolina to create villages. If you're familiar with the village programs that started in, I think it was Massachusetts, Beacon Hill, there's a village to village network. There are about 5 or 6 programs that are up and running in North Carolina in the state. There's a number of programs that are in development. So we've reached out to those programs to try to bring them into the fold. So far, every program that we have contacted, they're very enthusiastic about the consortium. Of course, membership is 100% free. So why would you not want to join the consortium? Right now, we're heavy on information. Our first step, and actually in the next week, the programs that we've found, and right now our steering committee has 4 programs on it represented. And then there's another 10, 11, we might be up to 12 programs beyond that. So we're still very small. We have a survey so that we can start finding out what are the challenges that programs are finding and what do they really want from the consortium. There's no point in building something that isn't going to meet folks' needs and not be what they want. So what are their challenges? What do they need solutions for? What can we help with? Looking down the road, hopefully in the next few months, we're going to start offering regular opportunities for program information sharing. The surveys, we believe, will give us information about what educational topics folks are looking for. So our first steps are really directed to the programs that exist and meeting their needs, helping them solve problems, getting to know each other and understanding how we all run our programs, because based on the steering committee, we're all running them differently. Then we want to create a best practices manual that will assist programs in running best practices, but also be a guide for programs that want to start up, so new programs. And we also have in our work plan, to create either a website or a web page where we can use it as the home base for sharing resources and accessing other programs. So that is where we are. And I think we're holding questions until after Kathy speaks. So I'll stop sharing.
Thank you, Elaine. That was wonderful. And we are holding questions until the end, but please feel free to, if you don't want to forget what your question is until the end, feel free to type it into the chat and we'll be sure to get to it once Kathy's presented. Kathy, I just want you to know that a lot of people in the chat, when I asked them to comment on what they'd like to get out of today, there are quite a few people that said, we want to know how to connect with the faith community. So with that, I'm going to share my screen so you can do your presentation and share all that wisdom.
Well, that sounds good. And I'm looking forward to the discussion at the end to see if we can get any new ideas, because it's getting ever more challenging by the day. So, Jill,
can you see the screen yet?
I can see it. Yes, okay. Thank you. Yeah, great. If you want to go ahead and advance it to the next one. Well, the South Carolina Respite Coalition has actually been in existence since 2000. We started in the late 90s and then incorporated in 2000. And so we have really been working with the faith community as long as we've been in business. And we've done a variety of different things with them. We really consider it a part of our mission, which is to develop quality respite for caregivers across the state. And so the faith community is really just one of the groups and organizations that we work with whenever we have the opportunity. Because one of the things that we've learned is as different respite models have been developed, they'll pretty much work anyway. You just have to know the group. If you're working within the faith community, there are some different things that you need to know and ways that you need to do things that might be different than if you're working with a community-based organization. But basically most of the models will work within the faith community as well as anywhere else. I think we also have the benefit in South Carolina that our partner, the South Carolina Department of Education, who is actually the Lifespan grantee in South Carolina, also has a long history of working with the faith community. So that partnership, I think, sometimes has opened doors for us as well. But I guess our strategy in the very beginning, and I think it still is one that would work well, is really just to provide education. And so we have had several smaller grants along the way that allowed us to develop education programs that were targeted at the faith community. The first one that we had early in 2000 was called Next Best to Kin. And that really came out of the fact that we felt like, especially in the South and in the Bible Belt, that families and in rural areas as well really felt like their faith community was their family. And so if trust was going to be there, then somebody from your church family or your faith family was going to be next best to kin. So another thing that we did for years, I don't even know exactly how many years, was an annual Respite Solutions Faith Community Conference. And so we every year would bring together presentations. In the beginning, some of it was really just introducing people to various disabilities and the needs of caregivers, how to care for different people, inclusion strategies, and then a variety of respite models. And so this conference, we probably ranged from about 85 to maybe 140 people each year from a variety of faith organizations. We would always host it at a house of worship. And a lot of our connections in the beginning came out of this conference. People would come to the workshops. It would spark kind of a thought about what might work, about the families that they had in their congregations, the needs that they would have, and a particular kind of program that might work for them. So we'd have discussions at the conference, and then they'd reach back out to us, and then we would be able to offer technical assistance with that faith community. So in the beginning, and I still think today that is one of the best ways to really engage with the faith community. I think another thing that we have found in all of this work is that you really just can't, call or reach out to churches and or any faith group and expect to really get a lot of results. Our most success has come from when we've had a connection with someone in particular faith groups, because that introduction, that person having a vision, really kind of thinking about what would work in their church, then provides the opportunity for us to come in and help them either develop a plan, talk with leadership, and really begin to get things going. But we have tried a variety of different things, and I think when it comes down to it, that is one of the most successful things that we've been able to do. All right, Jill, if you would go ahead and advance. So just some examples of some other faith-based programs that we've done over the years. We have developed respite cooperatives within faith communities. And that really is where in this particular model, you actually have family caregivers involved in with volunteers in actually organizing and providing the respite care. And this was done because, and particularly with children with special healthcare needs or children with special needs, parents were really not overly comfortable having their kids stay with people that they didn't know. So this provided an opportunity for the families to participate, to actually provide training to those respite volunteers on the unique needs of their own children, really get comfortable with the situation. And then they were only asked to participate, once, maybe twice, maybe 3 times a year. And these respite cooperatives were usually held on a monthly basis. The other thing that we have done, and I think in some ways, when we talked about our future activities, we may go back to something like this. And this kind of comes from more of a sustainability kind of thing, but really doing partnerships with between faith communities and community-based organizations. With one of our, I think this was a grant funded through our Developmental Disabilities Council in South Carolina. We actually were able to partner with and develop a summer respite program for youth with disabilities. We combined with a county recreation center who actually provided a staff coordinator. And then we engaged the church youth senior high youth group with their advisors who provided on a weekly basis a morning of respite where youth with disabilities could come to the recreation center and participate in a variety of activities that were coordinated and organized by that staff coordinator. I think one of the best things about this program, and this is one of the things I love about these kind of group respite opportunities, is there were some, one is it's in a natural environment, and that's really one of the things that we really try to do. But one of the unanticipated outcomes was the personal connections that were made between the youth group kids who were typically developing senior high and those youth who had disabilities or special healthcare needs. They were over the course of the summer, there were friendships developed. So when they returned to school, those connections were there, and some of these kids with disabilities who had never really felt a part of anything would go down the hall and see, somebody from that youth program who would give them a high five, or really just acknowledge that connection. And so that was really one of my favorite programs that we've done. And then the other thing that we have done is we've had 2 different rounds of mini grants that were really targeted toward the faith community. The first one was really one that was just open-ended. And so we reached out and provided, the requirements with regard to respite, but really didn't define what the program was. So each applicant was able to define respite and develop a kind of program that worked within their own organization. And one of the ones that I remember was with the Jewish Community Center, and they had a lunch every Friday. And so what they added to that was they created an opportunity where they invited people caring for their loved ones at home to lunch, and then provided respite for their care recipients. And so that opened up the door for more people to be able to come because they didn't have to leave their care recipient at home, and there were activities provided for the care recipients so the caregivers could get a break in the same location, socialize with their friends, have a good meal. But the the care recipients also had the opportunity to get out and socialize and be a part of something as well. Our second mini grant opportunity is actually the one that we're engaged in now. We started it in our last Lifespan Respite Grant, and that is creating the Respite Breakroom project. And so I'm going to talk a little bit about that project. Jill, if you'll advance to the next slide. So a respite break room is really a center-based respite program, and it's a physical space that is really dedicated to this break room and is housed in a place of worship. So the idea behind this was really to help the faith community re-engage with caregivers who had kind of fallen away from church or from their faith home because they were full-time caregivers. And they had difficulty either finding someone to stay with their loved one or really being able to bring that person into the service and not be focused more on their care recipient than they could be on the church service itself. So again, this is a respite opportunity in a natural setting. And it really is mostly a volunteer respite program. However, some actually will have a staff person that helps to coordinate it and recruit the volunteers. But it has been an interesting program as much for the timing as anything else. But the one point that I did want to make in terms of working with the faith community is the need for flexibility. While we've kind of defined what a break room is and we have requirements for what the break room is, the reality is no two break rooms that we have been able to establish are the same. They serve different populations, although most that we have right now in this first round serve people with Alzheimer's, caregivers who were caring for someone with Alzheimer's. But we had one group that actually covered the lifespan. So they were working with children and youth with disabilities, as well as older adults in the same break room. But the mini grants really were focused on simply helping them establish the break room, get it up and running by purchase, furniture that would be appropriate for individuals, activities. Some of them put a sound system in that allowed the service to be piped in. And if people in the break room wanted to listen, they could. So just again, a variety of things. We had single churches versus we had one group that's actually combined forces with another church that is basically just down the road. I think size of the faith group ranged from very small rural churches up to very large congregations. The physical space and the activities obviously were different, particularly with related to the different populations that are there. And then the pool of volunteers available. The smaller congregations obviously did not have as many volunteers if they did the break rooms by themselves. And then those larger, mid-sized to larger congregations had a larger pool of volunteers. Okay, Jill, next slide. And so the current status of the break room, largely due to COVID, is that we went from, we actually awarded 6 mini grants. We were able to get 5 of those up and operational before COVID hit. And then since then, we have 2 that have been able to successfully reopen. And so we, as a part of this grant, we developed a how-to guide, which really focuses more on how to develop a break room, how to develop the plan, how to get leadership buy-in, how to recruit volunteers as well as recruit families. And so I think that if you're interested in actually developing a break room, then I would encourage you to utilize this guide. The link that is in the PowerPoint is actually a link to the South Carolina Respite Coalition website, and then I think Jill has also got it up on the ARCH website under those state tools. Okay, Jill, next slide. So the challenges that we faced with this, as did everybody over the last 2 years, was COVID. That was the major challenge. There are some general ones, but this is really the major one. We started in probably in 1819 with these programs, and then by March of 2020, everything shut down. All in-person activities in South Carolina, like everywhere, really stopped. Many of the congregations in South Carolina statewide are still not back to full capacity with regard to in-person attendance. There's a much smaller percent of members who are just not attending in person. And we had 2 specific break rooms. These are those smaller churches that actually struggled to recruit new participants. They were focused on older adults with Alzheimer's, and during COVID, they had participants that passed away, and so they have struggled since then to really recruit people back to the break room. And so those break rooms particularly have not reopened. I think just in general, as I've mentioned before, some of the general challenges are the size of the faith group. The mid to large congregations actually do better because they have a larger pool of volunteers and potential participants. And then this is not just with break rooms. This is really a challenge anytime that you're working with a faith community, is really understanding the leadership structure, how decisions are made. I mean, and this goes to whether you're just trying to begin to engage a faith group, or if you're actually already working with them. Understanding that leadership structure and how those decisions are made will make a big difference in just getting something started, getting permission to even engage with that faith community, or getting permission to do different kinds of respite activities in that congregation. Okay, Jill, next slide. So during COVID, these are some of the adaptations and alternative activities that we did, mainly to partially to provide support, continue to provide support for caregivers, and just maintain that contact and momentum of those break rooms. But some of the things that the churches themselves did was to have their break room volunteers provide check-ins with the family caregivers, again, making that regular contact with them, providing support. Some of them actually developed a telephonic caregiver support networks so that all of the members, not only within the break rooms, but other caregivers in the church could participate in this and really provide support for each other during that time. Another thing that we really tried to embed in the break rooms was to make it an educational opportunity, so that those break room volunteers shared information and referrals with those caregivers. So during this time, that was a specific push, was to really reach out to caregivers, help them understand what caregiving resources were available, what resources were available to their care recipient, and then make referrals to those programs so that they could begin to get services if they were not already getting services. And then some of those churches actually opened vaccine sites. And so if they had a break room in doing that, then they opened the break room during those vaccine times so that caregivers and the care receivers had a place to be when they came in to get the vaccines. So the Respite Coalition and the South Carolina Department on Aging also took the opportunity during this time to stay engaged with those break room volunteers. Initially, during the break rooms, our initial training was really, again, focused on getting the break rooms up and going, getting the physical space ready, recruiting volunteers, recruiting the caregivers. And so we took this opportunity to actually engage other partners to provide training to those break room volunteers through the virtual opportunities at the university and the School of Public Health. We have a program that's called Dementia Dialogues, and it was developed years ago. I actually think it's a national model now, but we engaged them to provide training around dementia to those caregivers and to the volunteers during this time. And then we engaged the Alzheimer's Association of South Carolina to do additional virtual training on just understanding the varying stages of Alzheimer's disease and how care changes when you are providing providing care to a person with Alzheimer's. And then we also just developed a series of webinars that we thought would be useful. And while these weren't specifically for break room volunteers, they were opened up to them and they were encouraged to participate. And these things ranged from having the state epidemiologists come and really talk about COVID, talk about precautions, talk about best practices, and really what they knew up to date at that time. And then we also had one that was focused on respite in the faith community and how faith communities could support caregivers. Okay. Then also as a part of our Lifespan Grant, and one of the additional enhancements to that is we actually developed PPE care packages. And those included, things like, obviously hand sanitizers, masks, the printed resources that Arch had developed related to COVID and how to reopen respite programs. We included copies of that. So we provided boxes of these care packages to the break rooms so that when they were able to reopen, they would have some of the supplies that they needed to do that. All right, next slide, Jill. So I know that this is a lot of what folks have expressed interest in. And so here are just some of our tips in how to engage faith groups. I think one of the things that we have found is that, like most of what we do, you really have to build relationships and trust with those faith groups. We have done things like invite faith leaders to participate on our advisory boards. We have a state committee on respite. And so including some of the leadership in the faith community on that advisory board and in engaging them in helping to develop our state plans. That really begins to engage them in that broader understanding of respite, and really has been valuable in understanding, I think, what the faith community would be looking for in trying to develop those programs and develop any kind of a special needs or respite ministry. The other thing that we are really that we have done in the past, and I think are really thinking about even more so now, is identifying partners that we work with who already have connections in the faith community, and really kind of piggyback on the trust that they have developed. Like I said, in the Alzheimer's Association, at our last state committee on respite, we were really talking about some of the challenges in developing additional break rooms. And the Alzheimer's Association is working with the church in another area of the state. And so we talked about how we could, be brought in with the work that they're doing, because their focus is really on Alzheimer's, and then our support could be in either developing a break room or really helping them to develop other respite resources, but understanding and providing that technical assistance and training related to that. I mentioned earlier that we had a grant from the Developmental Disabilities Council. There was a time when they fund small programs every year, and there was a time when respite was a priority area for them. And so we benefited from that. And in a couple of cases with those grants, the recreation program was one, but we've also used those grants for education related to respite in the faith community. I think that the other thing, I'll just talk about that now, that happened at our last state committee meeting, is we have a representative there from the hospice community, and she works with a group of 40 churches in another part of the state. And so I think going in through her contact and that consortium and really trying to begin to work with them will be another way to gain the trust, so that they know who we are, they know what we do, and see if that develops into any specific invitations into individual churches. I think the other thing that, or the other strategies that we have used all along is, in some ways, that these are probably not, in terms of percentage wise, not going to make a difference, but casting a wide net to identify interest in even working with caregivers or doing some sort of a respite program. The types of things that we've talked about doing is just including articles, news articles in some of those state faith-based newsletters for the various denominations, just letting folks know what respite is, what the needs of caregivers are, ways to get involved through those with caregivers, and developing some sort of programs. And the idea behind that, just like all of our educational activities, whether it's a presentation at a conference for groups with disabilities, or caregiving groups, or faith in action groups, is again just to spark that interest, just to continue our education mission in all opportunities that we have, but also add in the role of the churches and the opportunities for churches to develop ministries that can better serve the caregivers in their congregations. And then I think the other thing that we have learned, and this is more from a sustainability, is that once you're in the door, really being prepared to provide that ongoing training and technical assistance and support. There's a lot of interest in faith groups about supporting their caregiving community. They just don't know how to do it in a lot of ways. So if you can get the interest and you can get your foot in the door, you need to really be prepared to be able to provide the type of ongoing training and technical assistance that will allow them not only to start something, but also help them at times where it may not be continuing, or they may, the people involved are faced with life challenges. And so helping them to develop those backup plans and develop the things that they need in order to be able to keep things going. But faith communities have a variety of specific ministries, whether they're care teams, whether there's a ministry for older adults or children and adults with special needs. There are a lot of, one of the things in particularly the AME church, and I think a lot of churches, are women's missions. And if you can get into some sort of a contact with someone who is a part of the women's ministry in a faith community, then that opens a lot of doors to those people who are really interested in providing the support for caregivers. Okay, Jill, next slide. And this is really more the lessons learned from our from not only the break room, but from all of our experiences within the faith community. To really be able to get something going and get a program started, you have to gain the leadership buy-in and the support before beginning. And all of these things are incorporated into that how-to guide, because these were really kind of major lessons learned and major strategies that we wanted them to know or any faith group that wanted to start a break room, really how to do it and be successful. But gaining that leadership buy-in, understanding the leadership structure, because those who really had not done this took much longer to get the break rooms up and going. Those who actually had a strong vision from the beginning and a well-developed proposal that they could present to the leadership in their faith group really were able to get started much sooner with stronger programs. They were able to establish, I think the other thing is establishing a respite initiative leadership group, so that it's not just one visionary that is trying to do it all, but actually a group of 2 to 5 individuals who are all committed to making this work, and being able to step in when someone in that group has to step aside for family issues or any other, or health issues or any other reason. And as I mentioned earlier, I can't really say this or overstate this enough. They really need to have large pools of volunteers, whether this is within their own faith community, whether they partner with other churches, whether they partner with a high school group or with a college nearby, a nursing program, a social work program, and bring in college students. Whatever way that they can actually build a large pool of volunteers will make it a much more successful and sustainable program. And I think that brings us to the end. I think the only thing that I wanted to say is that passion led us here. And I think that's not just in South Carolina, but from my 35 years within the respite community nationally, that is probably the thing that keeps me in this network. It is really the passion that everybody brings to the table. And I think, and so I hopefully this has been helpful, and I'm really interested in not only seeing your questions, but any other ideas that you all have to share as well.
Thank you so much, Kathy. So many years of wisdom and great experience. Really appreciate you sharing that. We do have a few questions in the chat. So let's get to those first. The first one from Cheryl Donnell in Nevada. She'd like to know, did faith-based respite programs need to be a certain size of volunteers and people with disabilities to be sustainable? You did address that a little bit toward the end, but Kathy.
I think that to be sustainable, I think that the mid to large size congregations have a better chance at doing that because they do have the larger pool. However, I would really like to see, South Carolina is a rural state, and I would really like for us to be able to encourage groups of churches to be able to work together. In that how-to guide for that particular effort, we do recommend at least within the break room, at least 2 people per participant. And then we also recommend in scheduling for those on-site that you actually schedule twice as many as you need, so that if somebody gets sick or something happens, you've got somebody on standby that you can call in. So I think it depends really on the program that you're doing, but you need volunteers for everything. You need volunteers for organizing and managing it. You need volunteers who can speak to leadership and get the leadership buy-in. You need volunteers who can market the program and recruit your caregivers, because I think what we found with those smaller churches is that they lost people during COVID, not necessarily to COVID, but they lost people during COVID, and then they struggled to bring in more. So I think that you should always encourage faith groups to constantly be in that recruiting mode, not only for volunteers, but also for participants. And but I think the number of participants that you have will in large part be defined by the number of volunteers that you can bring into the program.
I wonder, Elaine, if you might address that too, not just for the faith-based programs, but for volunteer programs generally. Is there a certain number of volunteers and people that have to participate to ensure that the program will continue for a while?
Well, the answer is what's your pool of clients? How many people are you trying to serve? What we've found with our Caregiver Respite program, those are, well, the family caregivers are taking care of care recipients who are the least healthy. That is our most dynamic program where, sometimes they're in our program for 4 months and then they have to go to hospice, they pass away, they get to a point where they have to go into skilled nursing. And we've done a really good job of, I should say Lisa, our caregiver support manager, has done a really good job of sort of keeping her volunteers in her program. And so when there's a change in one caregiver respite, she just moves them on to another family. She's sort of constantly assessing what would be their next best match. And so we need fewer volunteers in that program to be able to serve the people we're serving, whereas in our other volunteer programs, we never have enough. There's an increasing demand and we're constantly trying to bring in more volunteers. So it's really, how many people are you trying to serve? It's going to drive that.
That makes sense. Another question from Deborah. She wants to know, were there more, and I think this is for Kathy, were there more expansive best practices within faith-based communities beyond the example you used of the Jewish congregation that was providing services that focus primarily on the well-being and respite for the caregiver themselves versus the person being cared for?
They're not, well, let me just say what we have had a variety of different, I guess, models that I didn't talk about. We have had programs where they created support groups within churches, and so in doing that, then they would have a respite room, and they would have volunteers who would provide programming for the care receivers as well. But a major focus of that was the support group for the caregivers themselves. There is another program that our Office on Aging is doing. They have one of the Alzheimer's Disease Program Initiative grants, and they have built in caregiver training for that. This is a faith-based initiative as well, because they're working with predominantly the AME churches and the Women's Mission Service in 3 regions of the state. It's not exclusively to the AME, but that's that is one of that's where most of the program activities are doing now. And they introduced, I don't know if folks are familiar with Powerful Tools for Caregivers, which is a training program specifically for caregivers, and it is designed to help caregivers learn how to take care of themselves, help to find resources for their care receivers, and just, it really is focused on that caregiver well-being. And in my other hat at the university, we're actually doing the evaluation for that program. But for anybody that goes through that Powerful Tools for Caregivers program, and what they did is they had the Women's Mission, the volunteers there get trained as trainers in that program, and then they went back to their home congregations and communities and recruited caregivers to go through the Powerful Tools for Caregivers training. And anybody who goes through that, then they're working through their aging and disability resource centers or their family caregiver support programs to actually provide respite to those individuals. So the idea is to teach people how to care for yourself, teach people what respite is, and then make respite vouchers available to those individuals. So those are some examples of what we're doing. or what we've done in South Carolina.
Thank you, Kathy. Deborah was also asking about the mini grants being awarded to other states and what's the source of these grants. For those of you who are not associated or affiliated with the Lifespan Respite Care Program or a state respite coalition that's working with a Lifespan Respite Program, and we do have some people, the invitation to the Learning Collaborative has been distributed far and wide. So we have some people who may not be familiar with Lifespan Respite, but that is a federal program that awards grants to states. And many of our state Lifespan Respite grantees are using some of their funds to award mini grants to community-based agencies to expand volunteer and faith-based initiatives. So if you're in a state that's fortunate enough to have a Lifespan Respite grant, not every state does, or a state respite coalition, that coalition may be making some of their funds available for these mini grants, but unfortunately they're not available in every state.
For those states that do or don't have Lifespan grants that have mini grants, our first mini grants came from in South Carolina. Actually, our Office on Aging or Department on Aging operates this, but we have an Alzheimer's Resource Coordinating Council, and that is actually legislatively mandated, and they're given $150,000 a year. And so that particular program is focused on Alzheimer's, but they do mini grants every year. And I talked about earlier that we got one of our faith education grants from them, which really was our first work with the faith communities. But ours specifically funds mini grants to churches and other community partners who are either going to provide Alzheimer's education or respite programs. The others that you might look at, your Developmental Disabilities Council in your state. Every state has one. And they also, most of them, I think, provide mini grants. Again, that they have to develop a state plan. So depending on what their priority areas are, and like I said, our DD Council at one point had respite. They don't have respite now. So, but those are two, I think, potential sources. So contact your Department on Aging, your disability organizations, and just see, or DD Council, because if they're not doing it, they may know others who might be doing mini grants.
There is also the Community Care Corps that I mentioned earlier, that small federal initiative that's now awarding grants on a yearly basis. I think their grant program will probably maybe opening again in the next few months. So if you're a member of the Arch Network, you'll get notices about when those grants are available also. Anybody else have any input on funding for mini grants or funding for startup for community or faith-based?
Well, I mean, I would just, the variety of programs that we've had funding, I mean, we've had Christopher Reeves grants in the past. And I think there are foundations in every state. I mean, we have a Blue Cross Blue Shield Foundation in South Carolina, as well as the Duke Foundation. I mean, there are several foundations. The Duke Foundation in North Carolina and South Carolina actually have one of their departments is on working with the faith community. So I just, look at some of your foundations in your states and just see what's specific to your state. Because I think there are a variety of them that might actually have specific programs targeting work with faith community.
Great, thank you. Another question here from Cheryl, and this relates to, I think, what you were saying, Kathy, about the COVID adaptations that were happening in your state. And she wants to know, are those adaptations the preferred approach now? Are they still happening?
Yeah, Nicholas might want to weigh in on this. I think in some ways, people have gotten used to virtual. I know for us, we have regional councils, and trying to move back into in-person meetings is challenging, and it's really hard to engage people as much virtually as it is in person. But I also think that has been a little bit of a challenge with our break rooms, starting back up as well. But I think in terms of respite, it is really hard to give a caregiver a real break in a virtual environment. And so as much as it may, and we're still in COVID. I mean, we're not, as much as we'd all like to be out of it, we're not out of it yet. So the hesitancy there is real. So I think part of it for a while will be the preferred method. But I would hope in the not too distant future that we can get back to. We also have a voucher program. So, I mean, there are people who still want in-home care, but from those center-based programs, I think it is really a challenge. Oh, I guess one of the other things that we've talked about is working with the camps. And we provide vouchers for camps, and I think that that's another. It's outdoors, so I don't know if we can apply any of that to the work with the faith community. I think those that have childcare centers, there might be opportunities to work through those in developing some respite programs because they have the facilities. But I don't know. It's an excellent question, and I think the answer remains to be seen.
I mean, there were so many wonderfully creative things that were happening during COVID to support caregivers, and we don't know what the ultimate outcomes were of all of those programs. They were wonderfully creative, but did they really did they really help long-term reduce the stress and alleviate some of the need that family caregivers have for a real break? We don't know that yet, but I know a lot of states there were many flexibilities that were instituted through the work that they do, and many states plan to continue to offer those at least as alternatives as long as family caregivers are desiring those services.
Yeah, Jill, I can tell you from our very small sample size, and this is a very non-scientific assessment, but our family caregivers, they want time away, and they want more than 2 hours. They want a night away, a weekend away. Yeah. For them, there's no substitute for that time away to clear their heads, get a breath of fresh air. So as many programs as we put in front of them and try to be as creative as possible, it's respite that they want. Yeah. Pure and simple. But again, that's very unscientific.
It's valuable anecdotal information, though, Mary. Every little bit of information and data that we collect contributes to the bigger picture. I think John Blackard, you had your hand raised. Did you want to unmute yourself and ask a question?
I was doing a clapping emoji. I was loving every
flashed
bit
so quickly, I wasn't sure.
No, absolutely. Anything we can do to get more respite available to caregivers is really what I'm interested in. I did drop a question in the chat, and that was more just about maybe engaging in interfaith. I think a lot of times when I hear about other respite opportunities, and kind of mostly in rural settings, it tends to be churches. So I wondered if there's ever been like synagogues working with churches, synagogues working with mosques, if there's ever any kind of, say, interfaith relationship between the, say, provision of these more collaborative respite opportunities.
I'm familiar with quite a few of them, actually, especially those that are consortia of faith communities that provide respite, and it primarily has been around the provision of memory care or care for people with early stages of dementia. There's a program in Minnesota called the Gathering that has, I think, 20 or 30 congregations involved of all different faiths, and they alternate where the respite is provided and who the volunteers are. But it's a true interfaith collaborative, and I think there's a similar one in Houston. I mean, there are multiple situations like that. I know there was a model on our last Learning Collaborative call. We heard about a program in Alabama that was expanding their model, and it had expanded to all kinds of different congregations. outside of the Christian community. So I think it's definitely a growing interest in the coalitions are growing. And I think Kathy even mentioned that one of their break rooms was in the Jewish community as well. Anyone else have knowledge of that? Oh, go ahead, Kathy. You
No, I was
responded.
going to say that was the lunch, the
Yeah.
caregiver support thing, not really a break
Oh,
room,
right.
but they did provide respite in a room for the care receivers. So
That's great. Thank you for your help on that.
We do have another question here from Cheryl again. She says, we have so many families who do not participate in a faith community. I'm not sure what percentage of families would be reached. Certainly to the faith community with many people with disabilities or special health care needs, this would be of concern to that group and they would likely be more receptive. So strengthening that connection would be valuable. How many faith-based groups felt that they were already supporting their families well, or just had not considered respite support to the families, and how many get involved when another church has something to offer?
I don't know that, I think in our experience, because our initial recruitment really was through the Department on Aging, who was really trying to, they did a workshop on how to write a grant for the Alzheimer's Resource Coordinating Council. And that was really kind of the beginning of it. So it was more focused on that. I totally agree with you in that for me, and that's why when I said up front, any of the respite models that have been developed in any of those initiatives that we have had within the faith communities are models that would work outside the faith community. And so we really have multi-pronged approaches in our reaching out to a variety of different places where we might be able to host a break room or host some sort of a respite program. And I think in our future work, that kind of bringing partnerships together from a variety of groups is really what we would like to see happen. We have encouraged in all of our efforts in developing break rooms and really any other respite programs is for those congregations to open their doors. And while they might start with their own members, that they really to open it up to the community around them, so that it wasn't just completely closed off and only for their members. We kind of thought that would be an enticement to those faith groups as really an opportunity for that broader mission. I mean, I would agree with you that there are a lot of people who just won't go to churches and won't participate in that, so we have never been successful with that broader opening up to the community with the faith groups. With regard to those, I have, again, this is anecdotal data. We have definitely reached out to faith-based organizations proposing a break room and had them respond. We've already got a special needs ministry, and we feel like we're already providing the support that is needed within our own organization. So I think it is. I said before that we cast a wide net and really just try to reach those that would be interested, but yet the answer is, I think, yes to everything that you said. There are those that feel like they're already doing enough, and in some ways they are doing really good things. But it has been a challenge for us to get them to go beyond their own members at a time. And even in the interfaith, we have attempted some things with that and have not yet been successful. So just not something we've been able to get going.
Yeah. Oh, I see that Nicholas, who is the executive director of the South Carolina Respite Coalition and works with Kathy, put an interesting statistic in the chat. He says a recent Pew Research study shows that as of March of 2022, only 32% have gone back to attending church once a month. And of those, only 67% are in person. So returning to the physical space for respite is probably going to be a slow comeback.
Right.
Deborah has her hand raised. Would you like to unmute and ask a question?
Yeah, it was really more of a comment around the issue of what caregivers need. I was a caregiver for 11 years. My mom just passed away, but I'm also the founder of HC3D, helping caregivers. And there is absolutely no substitute for the mental well-being, the soul health well-being, the spiritual care, and all of that for a caregiver than the separation that is needed from the environment with their loved one. It's almost counterintuitive to believe that you would need separation, but just like in a situation where you have a mother that's nurturing her child, at some point there has to be a separation for the proper nurturing and healthy relationship to continue to flourish. It's similar to that, but I've done a lot of research on this over the 11 years, just through my own journey and through my own studies. And that separation is absolutely the thing that creates the rejuvenation and the recharge for the caregiver to return to their environment of giving care.
Just to kind of, I mean, I totally agree with what you said. I think the other thing that, you know, we all know from respite is that the care receiver needs the break too. And I think
absolutely.
The benefits of respite and that break essential to both parties. And again, you're right, rejuvenating that relationship and the appreciation for each other, and even, you know, being able to see the care receiver, you know, through somebody else's eyes, through that respite provider's eyes. Just the benefits of that break. I totally agree. I totally agree.
It sustained me, and the reality is that exchange that takes place in that separation is a mutually beneficial exchange. You know, I studied, even through my own experience, the shift that would take place in my mother by her having that short separation from me, anywhere from, ideally the best time frame is between 3 to 4 days, because of how long it takes the caregiver to actually come down from the intensive caregiving experience and journey, to be able to sleep a little bit, to be able to decompress, all of those things. But even my mother would be different upon my return, whether it be a day, 2 or 3 days. And so you're 100% right on that experience as well.
Well, we're coming to the last few minutes of our time together. I'll throw it out there. If anyone has any last minute questions that you'd like to ask, maybe unmute yourself, comment or questions, actually. Or if anyone has any updates that you'd like to share from your program or from your grant activities or your coalition activities. Any last words from our presenters? Elaine or Kathy, any closing remarks?
No, I would just say I appreciate the opportunity. I think, you know, just being able to talk with others and hear experiences. It's I love these learning collaboratives. I mean, they're just real. I appreciate what you do, Jill. I appreciate the opportunity for us to get together.
Well, that's what we're here for, is to provide that opportunity. You all are so wonderful for always being so generously willing to share your knowledge and your program experience. So thanks to all of you. Elaine, did you have anything you wanted to add before we say goodbye this afternoon?
Nope, I'll just echo exactly what Kathy said. I agree 100%.
Well, great. I hope you'll all return to our next learning collaborative, which will be in approximately 3 months. We're trying to do these quarterly And even today's session gave me lots of good ideas for the next collaborative. But if you also have ideas or people that you'd like to hear from, or if you'd like to present on your own successful initiatives, please let me know and we will get you on the schedule. And with that, if no one has any other questions, we will say good afternoon. And thank you so much to Elaine and Kathy for really wonderful presentations, for sharing again what they know and what they do so well. And to all of you for being here today. Thank you all. Have a great afternoon.
Thank you so much.
Thank you.
It's amazing. Thank you.